We will be starting in about 2 minutes. We will be starting in about 1 minute.
Good afternoon. This is Tracy Aaron. Thank you for joining us today for our weekly update of COVID-19 from the Health Department. We have some members from the executive team that will be answering questions. And I'm going to turn over to Sean Crabtree, Executive Director, to give us a weekly update starting off.
Jumping up and down.
I'm now sitting at the dock at the board, so can I turn over the weekly update to Stuart, who is sitting at the dock looking at the board? Stuart, are you at the dock looking at the board?
Yes.
Could you give
So
the
as of today, we have 9 hospitalized cases. One of those is a Dare County case, a McCreary County case, a Pulaski case. Taylor, and Wayne. We have 222 people who are isolated at this time. That would be in every county except for McCreary County. So we have 33 isolated in Adair, 68 in Casey, 1 in Clinton, 8 in Cumberland, 15 in Greene, none at this time in McCreary County, 37 in Pulaski, 20 in Russell, 26 in Taylor, 24 in Wayne. We have a total of 231 active cases right now. So those numbers would be 34 in Adair, 70 in Casey County, Clinton County 1, Cumberland County 8, Greene County 15, McCreary County 1, Pulaski County 38, Russell County is 20, Taylor County has 28, Wayne County has 16, again for the total of 231 active cases, 9 of which are in the hospital. 390 cases have so far recovered, 32 deaths as of today, with a total of 653 cases since we started tracking those back in March, our first case. Today, we are looking at, so far today, 8 additional cases at this time. We have more that are coming in and more that are being investigated at this time. So again, 231 active cases in the district.
So some things to add. We have, for the first time since the outbreak began, we have active cases, current live cases in all 10 counties. We also, right now, our growth rate, we're projecting to double our total caseload right now at every 14.2 days if the new case rate doesn't slow down. Of course, the only way that I believe we can get it to slow down is for people to social distance, to avoid crowds, to wear their masks, to sanitize, and the things that we always talk about. Also, our growth curve, how fast things are doubling. We have a steeper growth curve right now than we have at any point since the outbreak began, which just means we're adding new cases faster than at any other time. At a 14-day growth doubling rate, that means we're probably adding more cases as new than we are releasing cases as recovered. So it's really ramping up. So Tracy, I'll turn it back over to you unless Dr. Wayman has something to add.
Nope, thank you.
Okay, I want to remind everyone I have some questions, but as we walk through this meeting, if you have questions, to please type those in the chat box and we will get to those as we go through the meeting. First question is for you, Stuart. Russell County had a demolition derby this past weekend with a crowd of people at the fairgrounds. I was told the judge executive was totally against the event. However, the health department had approved it. It took place, and I was told there was no one there enforcing masks at all or social distancing. How can this be with the governor's orders?
Okay, so the health department, the only thing that we can do is review plans and compare them to the guidance that's on the Healthy at Work website, which we actually did for this demolition derby in Russell County. Now, in this instance, we did review the plans. We reviewed it against the event and venue guidance. The plans that they set forth met that guidance. So if a plan meets the guidance, we can't override that guidance and disallow the event. So if a plan that they propose, if it meets the guidance, then we have to allow that to happen. Once once that event takes place, then those sponsors are going to be responsible to make sure that what they've put in their plan is what they're putting in action as far as social distancing, masking. It's going to be up to them to be able to try and enforce the guidance of what they've put into place.
Okay, thank you, Stuart. Next question, I think it's for you, Sean, maybe, or Dr. Wayman. We know there's been an increased number of positive cases of COVID-19 in long-term care facilities, such as Russell and Casey in the last week or so. If there is no visiting going on, who's bringing in those cases and spreading it? The workers?
All right, I'll take the first stab at this, and I'll let Dr. Wayman amend it as she sees fit. It's most likely that the workers or other essential personnel who are allowed to enter the facility are the ones who are contracting COVID-19 and bringing it in from the outside. The workers are monitoring for fever and symptoms, but if they are asymptomatic, they can still bring it at work and spread the virus. So that's a combination of my answer and Dr. Wayman's answer. I read it. Dr. Wayman, do you have anything to add?
The only thing I have to add is that if once it's in the facility, then obviously the spread is between residents to residents, or workers to workers, or workers to residents.
Yeah. There is one question in the chat box, Tracy. I'll go ahead and read it, and we'll kind of take those as they pop in. Are the cases that LCDHD posts in the daily report confirmed by the state labs? Taylor Regional Hospital, TRH, said they send off their positive cases to the state lab for confirmation. 99 times out of 100, what we post on our website is accurate to the day. They are lab confirmed cases. Now you will see sometimes the state's reports and our reports are off by 100 or 150. It's just, it takes the state a couple or 3 days to reconcile the numbers, and you know, there's a lot of new cases coming now. So between the time we post our numbers and the state posts their numbers, that can be a lot of difference. But yes, they are lab confirmed cases. There is an occasion when we mispost something, but we correct it the next day. Maybe it's someone we thought was one of our residents who ended up being a resident someplace else. You know, we might accidentally post a duplicate, but we correct that. So yes, they are. Everything we post on our website is 99% lab confirmed. There are, and Dr. Wayman may want to speak about this, there is one additional way we can add cases to the case count. It's called an EpiLink, and that's through CDC guidance. We can add a case as positive without a lab confirmation if they're showing symptoms, and if they've been closely in contact with a positive case, there can be what's called an EpiLink confirmation. So Dr. Wayman, is that pretty close to correct?
Yes, the only thing I would add is that the state lab does not confirm all the other tests that are done by other labs. So we take them as confirmed.
It's regardless of which lab confirms it, we take it.
Correct.
Yeah, and Taylor Regional Hospital may be working with the state lab. Other facilities may be working with other labs, but we accept any lab's positive results or negative results.
Okay, thank you all. The next question I think is yours, Stuart. How many cases were reported out of the Somerset Cracker Barrel, and were they shut down for cleaning or because the staff numbers were positive?
We didn't shut down Cracker Barrel. We did work with Cracker Barrel to decide what practice that they may want to employ now that they do have a cluster of several employees that are positive, and the decision was made by Cracker Barrel to return to the curbside service and pickup service. So as far as sanitization, they've been following the sanitization guidelines all along that are out there. We work closely with them to make sure that was happening. Also, temperature checks, all the monitoring for symptoms were going on. Currently, we have 8 staff that is tested positive for COVID-19 at the Somerset Cracker Barrel.
Now, Stuart, Pulaski County has 38, according to yesterday's number, 38 positive cases. That's
Yes.
active cases in our community right now, and they've had 109 so far in total. I'm bringing that up because sometimes people will say, well, why don't you post these businesses? When a business has one positive case, that's not a cluster. And as long as we're reasonably sure we've reached out to everyone they came in contact with, we wouldn't report that. In this situation, it was enough employees that it would be defined as a cluster, and we were uncertain about how many customers might have been exposed. But, I drove by Cracker Barrel a few days ago, and they were really busy. I drove by today, and there wasn't hardly anybody there for curbside service. And, I would say Cracker Barrel is probably one of the safest places you can eat at today. Their positive cases are isolated. They've sanitized. If you're avoiding Cracker Barrel, that's not hurting anything but their business. You're avoiding Cracker Barrel and you're going someplace else. You're going to a place that may not be sanitized as well as Cracker Barrel just sanitized, and may not have their, if they have any positive cases they don't know about, they wouldn't be separated from the other working crew that works the facility. So, we don't want to damage the business. We just want to keep the public safe. If they're, if they've cleaned everything and they've taken all the precautions, and the staff that needed to be isolated are isolated, and those that needed to be quarantined, that's about as safe a place as you could go. I don't know if you agree with me or not, Stuart or Dr. Wayman. You can chime in if you think I'm off base.
Let me add, as far as the reasoning why that was released, because when you're in a situation such as a restaurant where the public is coming in and you have no idea who may have come in contact with these cases. So the reason why a lot of businesses, if they were to have a cluster in them, we don't have to announce that, is because if it's a factory, for instance, the factory knows who their workers are. They know who's in that building, and we can do our contact tracing. If it's a church, generally churches know who attends that church, and if there are some visitors, maybe 2 or 3 visitors, then they, a lot of times we're able to figure that out. But in such a forward-facing business as a restaurant, there's no way of knowing who all could have come in contact. Now, we have asked restaurants now to start working in shifts, as in group shifts, so an A group and a B group. So if there's a positive in an A group, their contacts are limited to the A group, and the B group would be unaffected and could keep on working, and that way the business could keep operating. Also, what we're asking restaurants to do as a best practice is to, as customers come in and they're going to dine in, then write the number or the time that they came in and get their name and a telephone. So if we do have contacts, we're able to trace those back. By doing things like that, then we don't have to announce that to the public. We actually can figure out who those contacts are. If we know that waitress A is positive, we can go back and we can see who sat in waitress A's area and the people that she may have served and it may have come in contact with her that are public other than the employees there. So that is a best practice that we're asking restaurants to do, and that we're asking all businesses to split their workforce into work groups that stay together when they work, so it doesn't devastate your workforce.
Okay, thank you, Stuart. This next question is for you also, Stuart, and it's referring to Cracker Barrel also. You have notified the public about the cases at the Cracker Barrel in Somerset. When it comes to cases linked to restaurants, are they linked only to restaurants since dining is started back, or have some cases been linked to drive-through carryout?
As of right now, we don't have any test that has been linked to drive-through, carry-out, or to dining. We don't have any of that information yet. As we go along, I think further in this, we'll know a little bit more about it. But again, like I say, we haven't documented any employee-to-customer transmission yet. But if transmission occurred, you know, most likely that contact won't know how they've contracted the virus. So if they've been other places besides a restaurant, well, you can't say that, you know, you definitively caught it from that restaurant.
Okay, thank you, Stuart. Next question is going to be for you, Dr. Wayman. When will the test to see if you have already had the virus, when is that going to be available?
That test is already available. It's the antibody test. It is not quite as reliable as the PCR test, which actually tests for the acute case, illness, and it does, if positive, doesn't necessarily mean that you will be immune in several months. So yes, it already exists.
Okay. The next question is going to be for you too, Dr. Wayman. I would like to know if the number of active antibody tests are being segregated from the active cases being reported.
The antibody tests, because they're not quite as reliable, they have slightly different definition for a case. And when we deem that that result means that is a case, we count them as if they were a case. We have had approximately 15 out of the 600 or so cases that have been because of antibodies being positive.
Okay, thank you.
So they're not segregated out.
Okay. And the next question is for you also, Dr. Wayman. Can you give us an update on the effectiveness of wearing masks? I know we're being told that it protects the other person, but how well does it protect the one wearing the mask? And is there studies out there that the percentage has went up on the mask protecting ourselves?
It's a very difficult thing to calculate what the percentage is of protection, but the general consensus from all the studies is that if the person wearing the mask, if one person is wearing the mask, the risk of transmission decreases by half. That mask really protects the other person if only one person is wearing it. However, if both people are wearing it, the transmission rate can decrease by 80%. So it has definitely been shown to help. There was one particular study in Missouri where there were 2 symptomatic stylists in a hairstyle salon, and everybody was wearing masks, including the 98% of the clients, and there were no transmission whatsoever.
So if on top of the mask, you're keeping your 6-foot distance and you're avoiding crowds and you're only being around people as much as you have to be, that further decreases the risk or increases the odds that you're going to be able to avoid contracting the virus.
Okay. And the other question that regarding that is percentage protection also. So I'm going to skip that one, Dr. Wayman, because I think you answered that question already too. The next question is going to be yours, Sean. As the numbers continue to rise, Can we get a better breakdown of where contacts were made? You have provided generalities information on travel. Are there numbers available about where people travel? I would especially be interested in how many have made recent trips to the high number states such as Florida. And then it says on a side note, I assume that Florida's daily numbers are Florida residents, just as we count each case where the person lives and not where they work. Is there a count of the number of Kentuckians believed to have contracted COVID-19 due to travel to Florida?
Okay, there's several questions there. One, how does Florida keep up with their cases? I'm not entirely sure. I would assume they count it within their state. If you're a resident of the state, a resident of a county, they would count it by state and by county, just like we do. You know, I don't know that there's any state specific numbers statewide about where people have traveled to. I know there's some information because the governor talks about travel to Myrtle Beach and travel to Florida, but you know, I don't really know how much the state's keeping up with it. I know when we're doing our contact tracing and our case investigation, we do ask questions about recent travel and make notes of that. I was just interviewed a few minutes ago by a reporter, and I recalled this information from memory, and I'm thankful I remembered correctly. I don't have the time each day to post this out in detail. It's in a summary format on our website in a little donut chart's what it's called, that shows the different kinds of where the cases are coming from. But specifically for travel, we've had Alabama, 11 cases in our district has had recent travel to Alabama. 2 California, it looks like 4 Ohio. I'm skipping in-state travel. 15 to Florida, 3 to Georgia, 8 to Indiana, 1 to Minnesota, 2 to New York, 3 to Ohio, 13 to Tennessee, 2 to Texas, and to 1 Virginia. So it's not a surprise. Most of a lot of Kentuckians travel to Florida for vacation. Since we are a district that borders Tennessee, there's quite a few of our residents that go to Tennessee for business, and there's quite a few Tennessee residents that come to us for business. And I guess Indiana's the other highest one, and a lot of people from here have family in Indiana. So all 3 of those make sense that's where it would be coming in from as far as the travel.
Okay, thank you, Sean. The next question is going to be for you, Dr. Wayman. Let's see, I would also like to know if it is true that if a person tests positive, are they required to take a number of tests that have negative results before they can come out of isolation? And if so, is each positive result from the same person counted as a new positive test result in the numbers?
We use the no testing recommendations by the CDC for letting people out of isolation after treatment. That includes that there has been at least 10 days since symptom onset. They haven't had a fever for at least 72 hours, and their symptoms are improving. However, certain employers require a negative test, or perhaps even 2. If these come back positive, they are not counted. The duplicates are not counted in the total.
Tracy, I noticed the next question has to do with nasal swabs on the list that you provided. There's also a question in the chat box that is similar to that. So I'm going to go ahead and read it so Dr. Wayman can answer both at the same time. It says, why are most COVID tests here nasal swab, which are unpleasant and painful, instead of tonsil swabs? UK performs in-house tonsil swab COVID testing prior to surgery, which is much less unpleasant than the nasal swabs. So when you're answering the next one, think about that too, Dr. Wayman. What's the next one, Tracy?
It's kind of the same. Basically because the original tests were all tested on nasal swabs. So all the data we have was using that modality. The nasal swab is a little bit, I can't give you how much, but a little bit more sensitive at picking up virus. However, I'm sure that people are trying to use the throat swab for the reasons that were mentioned, that it is less unpleasant.
Okay, I
I
do
don't
not
know if
have any
that-
more sorry. I don't have any other questions, Sean. Are there any more in the text or in the chat box?
No, I don't see any. I was just reading through the list and making sure we didn't miss anything. I will try to stall for just about 20 or 30 seconds. Our YouTube live is about 20 or 30 seconds behind our interaction. So if anyone has another question, we have 56 people watching live. If you have a question, go ahead and type it in your YouTube chat box now. And if we can, we'll try to answer it. You know, I will say that I went to Walmart at lunch to pick up some batteries. We have my smoke detectors at home needed assistance, and I had to go in. I try to avoid going out and being around crowds as much as I can, and I did wear my mask. But anyway, the point I want to get to is, from what I saw, 100% of the employees were compliant, and about 98% of the public were wearing masks at that moment in time. Now that was the Walmart in Wayne County, which is better than I've seen at other times when I've been to Walmart. Much better. So maybe people are starting to catch on a little bit that this is serious, and it's growing very quickly. We know that wearing masks and social distancing and sanitizing and avoid crowds works. We know it absolutely. You know, we've seen positive cases in jails, in industries, in nursing homes, in all these environments that are difficult to contain the spread. And because they were following the guidance, that case didn't turn into a cluster of cases. And we've seen instances where businesses, churches, and so forth weren't following the guidance, and it did turn into a cluster. If you can social distance and wear a mask in those difficult situations, like a church or a jail or a nursing home or a factory, if it'll work in those situations, it'll work in public. So we really encourage people to follow the guidance. Question came in: is there a time frame to be tested after being exposed? Dr. Wayman?
Well, the incubation period is up to 14 days. However, most people that become ill do so approximately at 5 days. So approximately 5 to 6 days would be a good time to be tested, or when you have symptoms.
Someone just posted, Walmart in Somerset has been great with the masking. Kroger and Lowe's leaves a lot to be desired. Employees in those stores wear masks around their neck, not their mouth and nose. I too have seen a lot of people protecting their chin and not protecting their respiratory system. But you know, I can understand people want to catch a breath of fresh air every now and then. It's unpleasant. We ask people to make that unpleasant sacrifice because we don't want the virus to spread so quickly. I did see some emails this morning talking about Kroger and Lowe's specifically as corporate offices that are considering following Walmart's lead and making it a corporate wide policy to restrict access only to people who wear masks. So those would be very good examples. And the more that we're out and we see people doing it, and we see the more people in compliance, you know, all of the people doing things right will be a motivation for the people who are reluctant. You know, we none want to stand out in the crowd. Most of us don't want to stand out in the crowd. You know, I guess there will always be a few people who are non-compliant, but I'm very thankful for the people that are. My staff, you know, are working many, many, many hours, days, nights, weekends right now, really exhausting themselves. And it feels very frustrating when you feel like we're exhausting ourselves to try to help a public that doesn't seem to be too willing to try to help itself. But the people being compliant with the masking today, at least where I was at, gave me a lot of hope, and it really recharged me to think that maybe this thing can slow down a little bit if maybe it will if people will continue to be compliant. My final thoughts before we close, I'll make these, and if anyone has any last minute questions, put them in. Uh, we know that this virus, short of a vaccine, is going to run its course through the population. We know that there's a certain percentage of people it's going to have a mortality rate attached to it, and a certain percentage of people are going to pass from this. But we also know that if the medical infrastructure gets overwhelmed, the mortality rate will go up because people won't be able to get in quickly to get the care they need. If the hospitals get overwhelmed and their ICU beds are full, and it doesn't matter if you're having a heart attack or a stroke or whatever, if the beds are full, the beds are full. And COVID-19 patients, when they go to the ICU, they don't rotate out in a few days. They end up being there for weeks and months. So the normal throughput for an ICU is compromised when COVID patients get in there and are in there for a very, very long period of time. It decreases their rolling capacity. So we want this to slow down before Kentucky becomes Texas or Arizona or Florida, where the hospitals are really in trouble. And again, that's all so that we can help improve the mortality rate, so that people can continue to get access to the care they need. I don't see any more questions. Guys, make sure you sanitize, wash your hands, wear a mask, or a face covering. There's new words we're supposed to be using. A face covering. Social distance. Don't be around crowds any more than you have to. And be sure and be kind to others. We thank you all for joining in. We will be coming back next week. Tracy, you want to sign us off?
Yes, thank you all for joining. We will be back next Wednesday at 2 o'clock. If you have questions, please send them to the health department by Melanie Williams. Thank you all. Have a good day.
Thank you all.